Welcome back. The month of May is Stroke Awareness Month, and there's an event coming up on Saturday. That's a first of its kind. We're going to find out about it. Shannon Medical Center sponsoring it. Lindsay McCarthy with Shannon and Magdalena Rogers with Home Health Care is here to talk about what is going on in Compass Rehab Hospital, which is where people go to. We're going to talk about in a minute after having strokes to rehab. But first, Lindsay, tell us kind of what you all planned on Saturday and what's happening.
Yes, so we're going to have our first ever and first annual Stroke Awareness Walk hosted by Shannon in the Shannon Rehab Hospital at the Rehab Hospital, and it'll start at 8. There will be a 1-mile walk, a little warm-up before the walk, and just family friendly. Bring your kids. We'll have games on the lawn and all of that as well.
Magdalene, we were trying to think of an easy way for people to explain where you all are off Appaloosa Trail, kind of off 2288.
Yes, just past the new HEB off of 2288 by Rio Concho West.
So you can kind of turn off Sherwood Way, 2288, then Appaloosa Trail, and you should find it from there. So tell us kind of who you all are expecting to come on Saturday.
Hopefully a lot of the community, stroke survivors, of course, but we really want this to be a community event to help people stay active. That's one of the best ways to reduce your risk for a stroke, and to learn more about stroke prevention.
Lindsay, let's talk about that. What are some of the things you can do? I'm assuming, too, the age range from stroke can range greatly.
Yes, so anyone can have a stroke. It doesn't matter what age you are. So some of the biggest things we tell you to watch out for: your blood pressure and your cholesterol levels, making sure you maintain a normal blood pressure level and normal cholesterol levels.
All right, the thing to do is call 911 immediately. Then after someone is treated, rehab comes into play, right?
Yes, at Shannon Rehabilitation Hospital, we have great nursing care and therapy for patients who've had a stroke to rehab and get back to doing what they love doing.
What is it they have to rehab? What's the goal of rehab in that kind of situation?
Yeah, so there's physical rehab. A lot of times after stroke, patients have weakness or paralysis on one side of their body. There's functional deficits, difficulty showering or transferring, and then there's cognitive deficits as well. As a speech pathologist, that's what I work with: cognitive, speech, language, and even swallowing difficulties.
All right, Lindsay, once again, what do people do now? Tell us about Saturday. Is there any kind of a pre-registration? Do you have to register?
No pre-registration. Show up at 8, and we'll do a warm-up at 8:30. You'll just sign a form that, just a little waiver so you can walk. That's the registration, and that's it.
Okay, and fun activities planned too, during and after?
Yes.
And bring the family, right?
Yes.
Including the AirMed helicopter.
That will be there also.
Yes,
well,
yes.
that's a good thing to look for when you're going down. Thank you all so much, Lindsay and Magdalene. Appreciate it.
Thank you.